Hi, so this little video is just going to talk you through digestion and also a little bit about enzymes here. So you can see these are the pages that are in the Year 8 textbook, so it's pages 14 to 15, and I'm going to talk you through all the different parts of the digestive system, how bacteria work, and then about enzymes here. So very quickly, if I just go to here, these are the organs of your digestive system. The whole purpose of digestion is to break down large insoluble molecules into smaller, more soluble ones that can be absorbed into the blood. Now, that is the definition. So breaking down large insoluble into smaller soluble molecules that can be absorbed. Digestion actually starts in the mouth, and you can often be told about mechanical versus chemical digestion. Now, in the mouth, obviously you've got the action of teeth breaking down the food, chewing it, actually making it into smaller pieces. You then mix it with the saliva. You can see here the salivary glands have been labelled as well. The saliva actually makes it softer and more easier to swallow, and then it's the motion of your tongue pushing it back which then helps you to swallow it. So digestion starts in the mouth, and that is mechanical digestion with the teeth, but also a bit of chemical digestion because of the addition of saliva, and there's actually some enzymes in there which we're going to come back to. So you swallow that, and it moves down here through your esophagus, sometimes referred to as the gullet. It's a bit of a hard word to spell, so please take a note of that. Now, your esophagus is actually made up of rings of muscle, and they squeeze the food down, and the food, remember, is in this little ball that you've swallowed, and the esophagus, the muscle, actually squeezes behind the ball to push it down into your stomach, and that action of the muscles doing that is called peristalsis. Now, food arrives at your stomach. You've actually got a little ring of muscle at the top of your stomach here as well, but the food arrives into the stomach, and again, this is like a bag of muscle. In your stomach, you've obviously got stomach acid that can get rid of any of the bacteria that you might not want in your food. And you've also got some more enzymes in there that can help break down proteins. Now, your stomach kind of churns up all the food, giving it a really good mix. After your stomach, it leaves here to go into the small intestine. Now, you can see there is a little addition here. The pancreas, we're going to come back to soon, adds in lots of enzymes. So this is your chemical digestion. It adds in enzymes which will break down the food. Your liver produces something called bile, and excess bile gets stored in the gallbladder. And what bile does is it's released into the small intestine where your food is, and it emulsifies fats. Emulsifies is the technical term that you need to use there. It basically means it makes it become into smaller fat droplets. Okay, from the small intestine, you can see, even though it's called the small intestine, it's actually really, really long. Small intestine is one of the most important parts of digestion because that is where absorption happens. All the nutrients are absorbed out of the small intestine and they go into your bloodstream. Into your bloodstream, they then move around the body to where they are needed. The small intestine does that because it's got little villi in it. They look like these little finger-like projections which increase surface area, and they help with that absorption. Okay, after the small intestine, you can see we move around here. Just for a note, there's your appendix there. They move into the large intestine. So by now, you hope that you've absorbed all the nutrients that you need. In the large intestine, the whole job of the large intestine is to absorb water. So as you move around the large intestine, the water is absorbed out of the food. It then gets stored, and if I just move this, it then gets stored here in the rectum, and then it will then pass out through the anus. Again, you've got muscles here which will control that. So that is the digestive system, a mixture of mechanical and chemical digestion. So from the mouth through to the esophagus, to the stomach, to the small intestine, to the large intestine, to the rectum, and then through the anus. They are the organs that digestion happens through, and that's them in order. As I said, these are other organs which are involved in digestion, but the food does not pass through them. So the salivary glands obviously in the mouth add the saliva, the liver and the gallbladder releasing the bile to emulsify fats, and the pancreas. So food does not pass through these organs, but they're still important in digestion. For those of you who want to, there's a really good video on this. It tells you here, it's called the National Geographic clip called the Digestive System. If you're a bit squeamish, there might be parts in that you may not enjoy, but it's really good to watch. Okay, enzymes then. Briefly talked about these. As it says here, enzymes break down large insoluble food molecules into smaller soluble ones, which can be absorbed through the small intestine into the blood. As it says again, different parts of the digestive tract have different pH conditions to enable different enzymes to work. So for an example, an enzyme in the stomach, where it's acidic, will work at a really low pH, like pH 2, 3, whereas an enzyme in the mouth will work more at pH 7. So what do enzymes actually do? As it says here, they break down the large insoluble molecules. Now what does that look like? So here is a protein molecule. What the enzymes will do is they'll basically break it up into smaller pieces that can then be absorbed. This one here, the protein as it is too big to pass through the small intestine wall. So enzymes break it up into smaller amino acids and we can digest them, we can absorb them. Starch gets broken down into smaller glucose molecules, and fat gets broken down into fatty acids and glycerol. So that is digestion.